Safety in medical practice is the buzzword of today. There is a huge expansion of knowledge and building up of new technologies and new surgical technique. A surgeon may be more interested in this and also may look at different outcomes for himself. However, for the patient and for his relatives, the single thing that's at the top of their mind is safety. We now know for sure that this is very important because statistics around the world shows that we still have a very unacceptable rate of medical complications. This may be either because that the disease is very serious or the procedure is complicated, but we also know that a large part of the complications are due to medical negligence and also medical errors. So safety must be inbuilt into any treatment protocol for any specialty. However, safety does not come very easily. So it has to be brought about by a good protocol, good discipline, and this has to be imbibed not just by the surgeon but by the entire team. And these protocols have to be built during the entire process of the treatment. Safety starts at the clinic with good assessment. Then you have to be careful about what are the investigations done and how you can prep the patient to the biggest ability, fullest ability possible so that he is in the best condition and the most fit condition for surgery. The surgeon must be prepared and also take responsibility for being the leader of the principles of safety for the entire team. So he must lead by example. He must make sure that his entire team is aware of the patient's condition, the plan that is being made for the patient, and make sure during the entire process of preoperative preparation, the intraoperative procedure and postoperative care and the rehabilitation that comes after it, that safety is inbuilt into the process completely. He should also be careful that the team is well trained, that every single person in the team knows his or her responsibility and is adequately trained for the process. There should always be a plan A, but also a plan B and a plan C, because there may be instances where things have to be changed and the plan has to be redefined during the surgery. And it is important that not only mentally, but also in the infrastructure and for all the other arrangements of the processes availability and instrumentation availability, that adequate care is taken, that everything is available. One of the other important aspects of safety is perfect communication. Unfortunately, the hospital's environment has got too many people built into the treatment protocols. There are many treatment personnel, there are many departments which are involved in the patient treatment. And miscommunication or delayed communication is certainly one of the important factors which leads to a disruption of safety. So communication skills in the entire department and all the treatment personnel is very important, and this should be looked into very carefully. In this important issue of safety, I think there is a huge role to be played by the industry also. Because with new technology, you are able to get good results. But also, if the new technology is not implemented after proper training, not only to the surgeon, but to the entire team and to the entire hospital scenario, there is a possibility of safety being disrupted and complications can be very high. So the industry must work hand in glove as a good collaborator, as a good partner with the medical team for building into safety. I think with many of these courses and instructional course lectures which are happening across the country, where the industry is also very much involved, there should be a high concentration not just on teaching of new techniques, but also hand in hand, there must be many courses and many symposia which are held on how to improve the safety scenario in the hospital. And this will go in a long way in achieving better results.